Hey, Dr. Tyler Williams with Pinecrest Dental here, and you're looking for some more information for a dentist who offers sedation near you. And you're not alone. There are thousands and thousands and thousands of people who suffer with dental anxiety, and we've been able to help so many people over the years that we want to share some of this information with you in making your decision. And more people bring this up, even people who previously haven't had a lot of dental anxiety. They just know that, hey, now there are some dentists who are offering a more comfortable way to get treatment. You know, most things that you get done from a physician or a surgeon or in a hospital usually going to be put out for most procedures, right? Other than maybe like if you're having a mole removed at the dermatologist or something like that. But in dentistry, for a long time, there's been less availability for these type of offerings to make your visits more comfortable. But now you have some new and better options that will help you not only be more comfortable during the procedure, but your recovery will be more comfortable after. And usually you'll forget most or all of what happened. Our patients love that too. I can't tell you how happy we've seen some of our patients be when they have come to us after a procedure or a very long procedure sometimes where they've had multiple teeth or their whole mouth worked on, and they say, you know what, I really can't remember anything that happened, and I wish I would have done that years ago because that was so much easier than just trying to have numbing in your mouth, right? So if this is something that sounds of interest to you, or you just hate the dentist, or you have a fear of needles or drills or just that smell of the dentist, this can be a really great way. Now, the first thing you want to do is make sure that your dentist is offering comfortable and progressive, but not overly aggressive treatment, right? For example, looking for a dentist that does biomimetic dentistry, which is a type of dentistry where you don't do crowns on teeth, because we know that when a tooth gets a crown, the chance is 1 in 2 or 1 in 3 that it's going to probably need a root canal at some point. And with biomimetic dentistry, we typically don't do crowns, which means your chance of root canal is much, much, much lower, right? In the early days of practice, I would see about 1 in 3 teeth that had a big crown put on them that would end up needing a root canal. When we adopted the biomimetic approach, it's probably less than 1 in 20 now that I see need a root canal within that same period of a few times. So if you ever had a tooth where it's felt too big or bulky, or you've gone to the dentist a bunch of times and had it adjusted and it still feels too high, or it just feels off or painful when you chew on it, maybe because the treatment was a bit too aggressive. The dentist probably had good intentions, but that happens sometimes. So that's kind of the first thing, is you want to feel comfortable with who you're working with so that when you wake up, you know that you're in good hands. Now, when it comes to sedation, there are different levels. Those go all the way from laughing gas, which is a very light sedative, all the way to being completely put out. The most common one we do is kind of in the middle. It's called oral sedation, and we give you this medication. It's like a heavy muscle relaxer, similar to what people use if they have like a wrenched back, and it makes you very, very drowsy. You usually forget 50 to 100% of what happened. And the other nice thing is that it makes your jaw nice and relaxed, so that when you wake up, you don't have a stiff or sore jaw from being open for sometimes 3 or 4 hours. And that makes your recovery better and you're more comfortable. But the risk of major complication from anesthesia is very low, especially when you compare it to general anesthesia being put out in the hospital. So it's nice, especially if you have multiple visits, where you can get this done and be sedated multiple times and be comfortable the entire time, which our patients absolutely love. If you have some more questions on the different types of sedation, please click on some of our other videos on this channel where you can learn more about dental sedation and the different levels and what they are. But if you're looking for a dentist near you that offers sedation, you also want to ask what type of procedures they offer sedation for, right? So we have people that come see us because they need like a preventative checkup or a deep cleaning, and they hate the feeling or the scraping on their gums of the cleaning, because they need something that's a little more involved, not just your average cleaning. And they prefer to be sedated for that. And that's a great option, right? So you want to find out, if you're fearful, especially, what can I get sedated for now? And then what about my ongoing maintenance, just in the case that you need something more involved? If you have some more questions on this, don't hesitate to call us or email us. Our contact information is below. Be happy to tell you some more about sedation. And then we also have a book about that I personally wrote about different types of dental options, and we include a section on sedation that may be of interest to you. So let us know if that would be helpful, and we look forward to seeing you on the next video. Have a great day.